Hello. So we are now going to observe Juliet inserting a Coude catheter. In the interest of simplicity, we're going to assume that all nurses are going to use sterile technique, and we're not going to be reviewing that. As you can see, Juliet is prepping the penis using the betadine and the circular motions very thoroughly. And again, we're not going to be excessive because it is a simulation materials. We don't want to ruin those. We would use a Urijet because of his known history. And we could use a Urijet for any patient, but we do have to order that in advance. I would open this Urijet and drop it into the sterile field so that it was ready for Juliet to use after she had prepped the meatus. So a few points of emphasis. Juliet's going to hold the penis in a perpendicular position, and she is going to slowly insert the Urijet, the lidocaine jelly, into the meatus and down the urethral tract. She does use the whole thing, and the purpose of that is to, again, lubricate the entire urethral tract. You'll notice that she's got the penis at 12 in a perpendicular location. And we would wait a couple of minutes to allow for the lidocaine effect, the anesthetic effect of that. So a couple of points of emphasis for the Coude catheter. When we go to insert the Coude, we would take the J point, the tip of that, and put it at 12 o'clock in relation to how it is inserted. And that is the natural urethral tract, again, going into the male's bladder. The other thing I want to point out is the position of the balloon port would be upright. And when that is upright, that Coude tip is upright. So as you can see, at 12 o'clock, we would put the tip in that direction, and then we would be telling Frank Foley that we're inserting now, and for him to relax. Take slow, deep breaths. And Juliet, if possible, is going to insert this catheter in our simulation lab all the way to the hub. If it doesn't advance, then that's okay, but the point is we would go down to the hub, we would have urine return at this point. We would not force it. It's like every other catheter. We could, if we had met resistance, Julia, what would we do if we met resistance? We would pull out slightly,
Sure.
Right? Or move the position of the penis.
In case it's coiled.
Yeah, it could have be slightly coiled or meeting resistance, and then try to advance it again. So then we would inflate our balloon. And we would gently let it slide back out. We would apply our stat lock before we applied it to the leg, and we would prep our leg, allowing for only 1 inch of catheter tubing slack. And in simulation lab, it's actually, this is too loose. This would not be a good position, and as you can see, that's how that would be, but that would be too loose. We only, in real life, only have 1 inch of slack. Any other points, Juliet?
No, it usually actually works very well, and then obviously the patient feels immediate relief, you know, when the urine is released.
One point of emphasis, if you are unable to accomplish this, you would contact the primary team and have a discussion about the urology consults that you would activate, or the urology guidance for that catheter insertion. So we wouldn't have other clinicians come in and attempt an insertion. If a nurse had used a Coude catheter and been unsuccessful, we would go for that consult. We'd have that discussion with the primary team and activate that urology consult. Thank you very much, Juliet.
Thank you.
Thank you.